Did you know that the practice of specific physical exercises can directly improve your sexual health and even help maintain stronger and longer-lasting erections? Today, I am going to show you, based on scientific studies, 5 exercises and methods that provenly potentiate your erection and your overall sexual health. Stick with me until the very end of this video, because the last method is simple, yet many people have no idea that it helps as much as it does. As we know, an erection is primarily a vascular phenomenon. Of course, it is also neurological, hormonal, emotional, and psychological, but for a full and satisfactory erection to occur, it is absolutely necessary for blood to reach the penis with the ideal flow and pressure. And for that to happen, your vascular health needs to be in check. Certain exercises associated with improving erections help by optimizing the irrigation of the musculature in the pelvic region, thereby enhancing your vascular health and, consequently, your erection. To understand this, we have to look at the anatomy. The penile blood flow, or the irrigation of the penis, starts all the way up at the internal iliac artery, which is a branch of the abdominal aorta, one of the main vessels in our body. The internal iliac artery branches off into the internal pudendal artery, which is the main highway responsible for blood flow to the penis. From this artery, smaller branches derive, such as the cavernous arteries, the penile artery, and the dorsal artery of the penis. These are the vessels that actually irrigate and bring oxygen-rich blood to the tissue to provide a satisfactory erection. If the blood is arriving effectively, the erection will be good. This is exactly why doctors prescribe vasodilators, such as tadalafil and sildenafil, for patients with erectile dysfunction. These medications work by dilating the arteries, mechanically improving the blood flow and the arrival of blood to the pelvic region and the penis. In a very similar way, the exercises and methods I am about to list contribute to muscular health and the improvement of penile circulation. The first category is aerobic exercise. Here, we are counting activities like brisk walking, light jogging, cycling, and swimming. These aerobic exercises are fundamental because they improve systemic blood flow, reduce vascular resistance throughout the body, and increase the production of nitric oxide. Nitric oxide is a chemical compound that is absolutely fundamental for a good erection. It is the signaling molecule that tells your blood vessels to relax and open up. A meta-analysis published in the Journal of Sexual Medicine in 2023 showed that men with erectile dysfunction who practiced regular aerobic exercises at least 3 times a week saw a significant improvement in their erectile function. The practice recommended by the World Health Organization is at least 150 minutes of aerobic exercise per week. This isn't just about heart health. It is about keeping the endothelial lining of your blood vessels healthy so they can respond when you need them to. The second type of exercise that boosts your sexual health is bodybuilding and strength training. Various studies have already pointed out that men who train with force and resistance regularly present lower rates of erectile dysfunction. Exercise involving strength and intensity is crucial for sexual function. Here, we can cite exercises such as squats, bench presses, and deadlifts. These are excellent allies, principally because they involve large muscle groups. It is particularly important for men to train the quadriceps and the lower body. Why? Because training these large muscle groups provides a greater stimulus for testosterone production. It helps optimize the androgen receptors present in the muscles. By increasing muscle mass and reducing visceral fat through strength training, you're creating a hormonal environment that supports high libido and strong erectile function. Now, I know what you might be thinking. Committing to hours of cardio and heavy lifting every single week is not easy, and it takes time to see results. But what if there was a way to target the biological root cause of your performance issues in just a few seconds a day? There is a bizarrely simple, 100% natural purple tonic that you can make at home. It's designed to flush out the boner killer enzyme that blocks blood flow, helping you regain that rock-hard firmness without living in the gym or taking dangerous pills. If you want to see exactly how this works, take your phone out and scan the QR code on your screen right now. It will take you to a special video presentation that explains everything. I've also pinned the link to that video in the top comment below. Don't wait until it's too late. Check it out. Aside from that daily habit, The third type of exercise you should be doing focuses on the pelvic floor. These are often referred to as Kegel exercises. While many people associate these with women, they are incredibly important for men. These exercises strengthen primarily the pubococcygeus muscle and the bulbocavernosus muscle. These are the muscles responsible for helping to maintain the blood inside the penis during an erection. Think of the arteries as the inflow and these muscles as the gatekeepers that stop the outflow. A clinical trial published in the British Journal of Urology in 2005 showed that men with erectile dysfunction who performed pelvic floor training had a significant improvement, not just in erection quality, but also in the control of premature ejaculation. A quick and practical tip on how to identify and train these muscles is as follows. When you are urinating, try to stop or interrupt the stream of urine. The muscle you use to cut off that flow is the muscle you need to work on. However, do not make a habit of doing this while urinating, as it can be bad for the bladder. Use it only to identify the muscle. Once you have located it, you can perform the exercises anywhere. You can start by holding the contraction for 15 seconds, then relaxing. Repeat this 10 to 15 times. Aim for at least 3 sets a day, 3 to 4 times per week, for a period of about 3 months. According to protocols, this consistency is where patients see a gain in sexual function and control. The fourth method is the utilization of vacuum therapy or penis pumps. These are vacuum devices often used in the rehabilitation of erectile function, especially in patients who have undergone prostate cancer surgery, such as a radical prostatectomy. This involves using a cylindrical device placed over the penis that generates negative pressure. This pressure mechanically forces blood inflow into the penis, promoting an erection. These devices facilitate penile irrigation, keeping the tissue active and oxygenated. This is vital because if the tissue does not receive regular oxygen-rich blood, it can begin to atrophy or scar, leading to permanent dysfunction. This is particularly common in the postoperative period for prostate surgery, but the principle applies to general maintenance as well for those with severe ED. You can find these pumps easily, but a word of caution, they can be automatic or manual. The automatic ones are generally easier to handle. However, stay alert. You should always use these with professional orientation, preferably from a pelvic floor physical therapist. They are the most indicated professionals to guide you on the correct form of usage and the protocols to follow. Using these devices incorrectly can lead to risks and damage, such as local hematomas, pain, or even penile injury caused by excessive pressure or ischemia. The time of use for a penis pump should be a maximum of 10 to 30 minutes, 2 to 3 times per week. Some studies have shown that associating vacuum therapy with medication therapy, like tadalafil, improves the rehabilitation of erectile function even further compared to medication alone. Finally, the fifth exercise involves the utilization of the penile extender. The penile extender is a device that is less commonly discussed in casual conversation, but is widely utilized in urological physiotherapy protocols for the rehabilitation of sexual function. It is also a primary conservative treatment for conditions involving acquired penile curvature, such as Peyronie's disease. The penile extender functions through a mechanism of continuous mechanical traction. It applies a low-level stretch to the tissue over time. While the evidence is not as robust as it is for aerobic exercise, studies suggest that using a penile extender for 1 to 2 hours per day for a minimum of 3 to 6 months can improve penile vascularization and erectile function. Furthermore, it contributes to the improvement of the angle of curvature in cases of Peyronie's disease. It is important to emphasize that the extender must be indicated and utilized in an individualized manner. It needs to be fitted to your specific measurements and adequate to the size and length of the penis to prevent injury. The duration of use also needs to be evaluated and increased gradually, always under the supervision of a health professional. This is not a tool to buy and use blindly. It is a medical device for therapy. It is clear that all 5 of these exercises and methods help significantly, but they do not substitute for a proper medical evaluation. Erectile dysfunction can often be the very first signal of serious underlying diseases. It acts as the canary in the coal mine for cardiovascular disease, diabetes, and severe hormonal alterations that need to be investigated. The arteries in the penis are smaller than the arteries in the heart. If they are clogging up, it is a warning sign that the heart might be next. Therefore, if the problem persists, do not ignore it. Do not simply self-medicate or rely solely on exercises if you are not seeing results. Look for a specialist. Taking care of your general health is synonymous with taking care of your sexual life. They are inextricably linked. If you found this information useful, please subscribe to the channel and like this video. Comment down below which of these exercises you are already aware of or which one you intend to start. This helps the algorithm deliver this important health content to more people who need it. Take care of your health, and I will see you in the next video.